what do you think? Should I leave my job? Yes or no?
Right. No, don't leave your job.
So today we're going to start by talking about the following topics. We're going to be speaking about therapy myths. What are some of the beliefs you hold about therapy without even realizing it? Things as a therapist that we wish our clients would know about therapy, and what are some of the things to know that can save you time in the therapy process itself. So I am really excited to jump into this. This is something that comes up day to day with clients, and so we are excited to share all this information with everyone.
Okay, so let's jump into the first one. What are some myths and beliefs that we find that people hold without even realizing?
Yeah, I think that that's a really big one because, the first step is to bring it into your awareness because you might not even know what it is that you're holding about therapy. And over the past few years, though, therapy has become a lot more accepted than it was in the past, but there's still some negative associations and positive associations that people have about therapy, but there's still certain myths that I think it's important for us to talk about. And I think that the first one is that therapists have the cure. I wish I was that powerful. It'd be kind of nice, like if I had that power for, somebody to come in and to say, I can really save you or completely heal this. Inherently in life, there's struggles. And to come in and to promise somebody that I can change it or fix it, I don't feel that that's honest of me. And I think people prefer honesty.
Why do you think people have this myth of like, oh, therapy's going to cure me?
Yeah, that's a good question. I think people, when they're coming to therapy, it's usually coming from a place of, I need to fix something, I'm in a lot of pain. And when you're in a lot of pain, you want a solution. You want a medicine for it. And so I think it really comes from that perspective of, I need to be cured. And it's a shame because I really do want to help them and I really do want to give them that cure, but that's not the right path. It's almost like you go to the doctor and you assume that you know which medicine he's going to give you, and then he says, actually, we're going to take a different course of treatment, and it takes time to readjust to that new course of treatment,
right?
But actually is better. Yeah. What do you think? I mean, when clients are coming to you and they're expecting to have a cure or for you to know all the answers or to treat them?
Yeah, I think that it's a big responsibility that's put on therapists also. Like, here's my problems and I'm putting it on you. And it's not about the therapist taking on the burden of the client's presenting problem that they're coming with. It's about kind of being there to guide the client through their process, whatever that looks like for them. And I think that people are overwhelmed with what's going on in their life. So it's easier to be like, okay, I found a person and I'm going to put it on them and now I don't have to worry about it anymore.
Yeah, exactly. It's like bringing in another person to place the pain onto, whether it's to share the pain with somebody, but also to say, I can't handle this. I need you to take care of it. Can you please solve it? And if it's not solved, I'm not angry at myself. I'm not angry at my spouse. I'm not angry at the parent or whoever else is involved. I can place it on this outside source, right, who then I don't have to face on a daily basis. It's just sort of like easier to project it on.
Right. Yeah.
I think also like one of the things that comes to me a lot is wanting to fix somebody, saying, can you fix my child? Can you make my child behave better? Can you make them help better at home?
Right.
Can you make my daughter ready to be married? Can you make my daughter not be so depressed? Or can you make my son be more appropriate? Or can you make my spouse more loving,
right,
more attentive? And that sort of like puts me in an uncomfortable bind because, number one, I've never met their family member or friend or whoever it is that they want to fix. There's almost like this hope of, if that person gets fixed, my life will be okay. And unfortunately, I don't know that person. And also, you can be okay even if that other person doesn't fix. It's almost like you're putting your future into the other person's hands rather than saying, I have the ability to be okay even if I can't control the other.
Yes, I think that's a big, important kind of sentence to highlight, that you can be okay even if the other person isn't fixed.
Yes. Yes, that's a very, very important one.
And I think that a lot of work is more about yourself than the other people. And I think there's this famous kind of line where it says like, the person that needs to be in the room is usually not the one in the room, right? So like the person, it could be there's a certain family member of yours that really is the one that needs to be in the session and they're not there. That doesn't mean that you can't get anywhere in therapy.
Right.
So I guess that would be another myth of thinking that, it doesn't, if let's say a couple issue, like there's no point of going to therapy if my husband's not going to come to therapy. And like, no, you can gain a lot individually yourself, even though the therapist is not going to be able to fix your husband, but they're going to help you come to a place of acceptance or learn coping skills that gets, that is going to be healing for you.
Yeah. So like in a systems theory, right, if we were thinking about it, if one part of the system changes, the whole system changes.
Right.
And I think that that's very valuable because you see sometimes where in a marriage, only one side wants to go for counseling. The other one says, absolutely not, I'm done with this, or I don't want to try it anymore, or they just don't want to go from the beginning. And the other partner says, what should I do? I feel so trapped. But even if they, as the individual, go for counseling, they can still shift something because if they're not responding in the same way, it forces the other person to respond in a different way. And I heard a really good analogy last night. When dealing in speeches, right, there's the shock factor of you're expecting something to happen, and when it doesn't, there's either humor that happens or people start paying attention. So if I would say, ring around the rosy, a pocket full of apples, you would say, wait, you said that wrong. All of a sudden I've caught your attention and it forces you to do something different because I'm not going in my routine.
Right.
And the same thing with couples, like when one couple starts one conversation and the conversation just goes in the same direction. But if another one starts and says a different tone of voice or a different approach to it, the other partner is forced to stop and think and saying, how will I respond new because you're not doing what you typically do. And so definitely those that think that you need both parties in the room or a parent and child need to be in the room, there is use in just going yourself and changing the system.
Right. Yeah. I like that. And I think a lot of times it's just about starting. Like people have like all these like thoughts in their head, like, is it for me? Is it not for me? Like just start the process and like things will come from that. Like even if you can't find the quote unquote perfect therapist that you're looking for, start with somebody because that's going to give you experience of what you like and what you don't like. So I think we see a lot of people like debating therapy for a while because they're looking for the perfect therapist or the perfect timing. And sometimes you just need to start.
Yeah, it's true. Like, so much of the overthinking comes in of I need the best therapist or I need the perfect therapist or I need the one who's going to understand me the most or who matches me the most. And sometimes you just have to jump right in, start, and at least get somewhere. And maybe it won't be the right one, but at least get yourself used to that process. Yeah. I think, going back to myths of what other things that we see, I think another one that comes my way a lot is I don't need therapy. Like, I'm just good. I can't benefit from therapy. I know myself. I know my situation. It just either it is what it is. I've tried so hard to get the help. Or from a standpoint of life is hard. Things just need to be the way they need to be. Or I can just speak to a friend. It'll be good. And sometimes that is the case, right? Friends are fabulous. Mentors are fabulous. Rabbanim are fabulous. It's always good to speak with family members. But therapy does have a unique space. And to really challenge that belief of I don't really need it, I'm good, or I don't have problems that can be solved.
Right. And the space looks different for everyone. So if you were at one point in your life going to therapy for, to work on some skills and now you got those skills, now maybe you can use the space to just, process what's going on in your week. So there's not like one way that therapy looks. And something that I feel that people tell me all the time is like, am I talking about the right topics in therapy? And like, there are no right topics to talk about in therapy.
Yes. I mean, that's where we see the perfectionism a little bit of like what is okay to say and what is not okay to say, as if there's like a right way to do therapy. And it's really what's going on in your life at that point. It's going to be so unique and tailored to your day, to your life, to your circumstances. And so not going in with, I have to accomplish this. Rather, I just have to take it with the flow.
Yeah. And what's interesting? I hear from my friends, I'll see things that they worry about that the therapist is thinking.
Yes.
Does my therapist like me? Is my therapist interested in this conversation? I don't want to be a boring client.
Right. Like, are they thinking about me after the session? Yeah, those are, from the client's perspective, just thinking about myself when you want to be liked. You want to be cared for. You want to know that I want to know that I'm important to them. I want to know that I'm making an impact on their life, and it's not just a paid transactional conversation. I want to know that we are actually connecting and are forming a real relationship, not just a paid work alliance. You want to know that there's some care there.
So these are kind of normal feelings that most people feel, that everyone has felt.
Yes.
At some point in their, therapy relationship with their client.
Yeah. And I think that that's a really good point, because with therapists, it's often the question of, does my therapist have to be a good person? Or does my therapist have to care about me? Should I look for those things?
Does my therapist have to go through the same thing as me?
Yes. Does my therapist care about me?
So we have all these questions about that people wonder about their therapist, right? Or need to know about their therapist. And the question is this important? Is it important that they're a good person? Is it important that they went through the same thing as we did? Is it important that they care for me, that they think about me? And these are things that people really wonder about when they start the therapeutic process. And not all of them do we necessarily have answers for. Like, I don't know if you are by somebody who's really genuine in the session, I think you'll feel that relationship. Someone who's authentic with you, you'll see that they care about you.
I think also, back to what we were saying earlier about the perfection of I need to get the perfect therapist. So these are some of the questions I think that people are trying to answer of, will a therapist care about me? Are they a good person? And some of those are true, right? We should be asking questions of, do I like this person? Am I talking with them easily? Do I feel trust? Do I feel safety? Those are all important things when you're with a therapist to know that the work is being done and that you're a good pair. But when that perfectionism comes in, where you start over questioning and thinking too much in it, that it's avoiding you from actually getting the help you need and starting, then we know that you need to really just jump in and get it started and maybe put these questions in the background and just feel it out as the sessions go.
Yeah, and something that I always tell people is to ask your therapist. If there's something that's kind of concerning you in the session, something that you're feeling like, you can bring it up. That's great work to take place in the session itself. Yes, it's always so important to have open dialogue with your therapist because the therapist is waiting for this. They can handle it. And you want to be an informed consumer, and you're entitled to be an informed consumer. Don't assume that you can't ask certain questions, certain things are not allowed or inappropriate. You're entitled to know how the therapist works, what the services are going to be, and what to expect. Yeah, I remember a client telling me that they Googled me and they found out, a couple of years ago, and they found out my age, and that really bothered them. But I was so happy that they brought it up so we can then talk about it, and get to some sort of place. And usually those kind of conversations make deeper connections. Yes. The openness definitely builds authenticity. Yeah. So I think people are afraid of asking their therapist certain questions because they don't want to insult them. They don't want to hurt them. They feel bad. They feel like they shouldn't be thinking that way. But I think, as long as it's said respectfully, there's nothing wrong that could be said in the session. Yes. And I think that that's a freedom of feeling like you can just let loose and ask. And that's really the therapy room is supposed to be that for you. You're supposed to feel relaxed. You're supposed to feel safe. Right. You don't have to worry what's my therapist going to think? Or am I going to hurt her by saying this? That. This is the place where you don't have to worry about the other person. Exactly. This is really about you. It's really about the work that you need to get done. And you should have that freedom to really be yourself. It makes me think, as we're talking about age, it makes me think of another common myth of that somebody who's older is wiser, or older or more experienced is better in a certain way. Or older than yourself. A lot of people want a therapist. The therapist has to be older than me. Right? I have a friend who's looking for a therapist now, and all she wants is someone older than her. Right. And, I think it varies by person, because some people will say I need younger because they're more hip, or they're more understanding, or they're more in my generation. They get it. But I remember when I was first starting out in an internship, I was given
clients who were sometimes 30, 40, 50 years older than I was. And that was always the first question of, how can I talk to you? You're so much younger than me. And it was an important conversation to just set the stage for us to have of, well, what's it like for you to sit with somebody who's so much younger than you? And what are your concerns of me being younger? Are you worried I'm not going to understand you? Are you worried I'm not mature enough? Are you worried that maybe I won't relate to you? Or does it feel odd for you that I'm the helper, yet the younger one? And what does it feel like being older? So this is something that we get asked all the time, right? Like friends coming over to us saying, at least me, friends coming over and saying, what should I know about therapy before I start? Or tell me everything I need to know before I go. What are some of the things you wish your clients knew before coming into your office?
I think some of it we a little bit touched on before, which is kind of knowing that therapy doesn't hold a cure, right? So therapy is, and I think we've said this in different ways, but therapy is this kind of this space where you can go through your process. And I think we've talked about this before about it allows you to manage, right? To be able to hold what you need, to build this container in the therapy space where you can hold what comes to you or what has happened to you, not necessarily getting rid of things that's happened. And I think that people come with this expectation of like, wait, you're not getting rid of this? Why is it still in me? We've been working for so long. And it's not about taking something out of you or getting rid of something, but it's about learning how to hold it within yourself.
Yeah, like we can't just erase problems.
Right.
I love that. I think it's a Japanese saying or one of these memes going around where it's a broken glass and then they glue it back together and it still looks broken. Yeah, and I kind of love that because I think that that's a really good example for what therapy is. Therapy is not really, it's not taking away what happened. I can never take back things. And, big things like deaths or big things like illnesses, divorce, those things, we can't retroactively get rid of them. But also in the small things of we can't take back emotions. We can't take back certain feelings that have been had. But sometimes we can pull it back together with the glue. And, I like what you said before of management versus cure. We're managing something. We're helping somebody live with it. The ability to live side by side with it rather than curing it. And one of the things I love, and I probably overuse this, but it's such a good analogy, is people will say, well, when is it going to be over? Like, when is my kid going to be cured? Or when is my spouse going to be cured? Or when am I going to be cured? And I always say, like, I'm sorry, the lab results, they didn't come back yet. I'm waiting for the lab results to come back yet, but there's no blood test.
Right.
It's not a strep. Strep, you take your antibiotics, it's gone, it's out of your system. Whereas here, it's not like that. It's more about sitting with it, learning to cope, waiting for time to pass, getting support, getting skills, getting tools. But it's not come in, fix, solve, leave.
Right.
So that's definitely something I think helpful for people going in to know, because it just helps with managing expectations.
Yeah. And I think the second important thing to know, again, we've touched upon it before, is kind of the idea that you're going to have to do the work here in therapy, not necessarily somebody else is going to be able to do the work, or not just attending therapy is enough, even though that's a big step.
Yes.
And that's might be even half the step. But the second half is like, okay, now we're going to have to talk about things. And people come to me and they want to work through their trauma and they're showing up in session, but they don't actually want to talk about it.
Right.
Which, sometimes people need that time to get there. But I think that there has to be a component of doing the work in the session in order for therapy to be helpful.
I think you're so right that for some people, even getting into the office is a ton of work. They've been in this state of should I not go to therapy? And finally they get the courage to walk into the office and find the right therapist. But then actually the work begins. Right.
That might be 50% of the work, right? They say acknowledging the problem, that's huge.
Right.
But there is a component of having to do the work also.
Yes. And I think people get confused of what it means, like doing the work. Like we use those concepts. It's almost like with marriage. It's, everyone says like marriage has struggles, but no one can really define exactly like what it is.
So how do we define doing the work?
Yeah. How do we define doing the work?
I think the first step is showing up. That's even part of doing the work. The second step is acknowledging the problems. The third step is being willing to talk about them, being willing to start processing them.
Yes.
Taking responsibility for some of them where appropriate.
Yeah.
What would you say is the next step?
Well, I think if someone is a more behavioral kind of therapist, then that's going to include doing the homework of, the worksheets that are given out, whether it's CBT or DBT, practicing those skills throughout the week.
Yeah, that applies to even not behavioral, right? Any sort of therapy that you're doing the work in the session. That's something that needs to be done at home as well, even if it's not as writing a CBT sheet, but it might be practicing your breathing when you're upset at night.
Like implementing what it was that you've discussed in that session.
Yeah, right. Yeah. Because ultimately therapy is a microcosm of your life, right? So if you're learning to make space in the session for you, you have to learn how to make space in your life for you as well.
Yeah. And I think, for some people also what it means to do the work is to think. And I don't mean think in circular ways or going back at the same, but really taking the other perspective that perhaps you've heard in therapy and to really digest it and to say, does this fit with me? Does it not fit with me? Am I acting in this way? Am I not acting in this way? What is it potentially that I can hold myself back from if I need to? Or what if maybe I'm holding myself back too much and I need to put myself into something more? And that's going to be specific case by case. But I think like doing the work is not always active in terms of physically active. Doing the work sometimes is thinking, internal. Changing your thoughts. Every time, you find yourself saying, I'm so bad. Of stopping and fighting yourself and saying, no, I'm not.
Right.
Or every time you feel like, I don't want to do that. Of saying, no, I need to work on procrastination. I am right now going to get up and out of bed and doing what I need to do.
So it's really implementing the skills or the lessons or the themes that are happening in your session, in your home.
Exactly. Yeah, it's really applying it.
Right.
Applying it, and most of that is happening in your thoughts, in your mindsets.
Yeah.
I just think going back to our question of what we wish our clients would know about therapy, I think this comes up for me a lot, and I wonder if it comes up for you as well, is there's certain questions that I'm asked that are not in the parameters of a therapist.
Yes, all the time.
Yeah. Whether it's, should I leave my job?
Right.
I'm in this job, I'm really unhappy. What do you think? Should I leave my job? Yes or no?
Right. No, don't leave your job. Right. That's not in, my capacity to be able to answer that question. It's so frustrating. Clients are like, just tell me.
Yeah. And I understand like that desire, that burning desire of somebody, please decide, please, give me a sign of what the right thing to do is, because this is stressing me out. And I just want somebody else to really tell me what the rightness is.
Right. But all I can really do is explore kind of both sides with you. That's the most they can do. And I think that people get so frustrated when they realize that, therapists can't do the work for you. Therapists can't make decisions for you. But I can just be here with you through this process, exploring it.
Yeah, I think it's such an uncomfortable position to be in, because we want to help. And we want to give them that freedom from the pain that they're going through. And I don't necessarily know what the right thing is. I don't know if they're going to be happier in the next job. I don't know the reason why it is exactly that they want to leave their job and what is now versus then. And that's why we have to ask a lot of questions to bring clarity into, well, why do you want to leave your job? What is bothering you about your current job? What are your options on the table for the next one? So we can break it apart into the small bits of what is it that's going on, and then deliver that back to you with more information, so that way you can go out and decide.
Right. And I think that's a really important point. We can never know what's best. Because sometimes, let's think of a friend, they'll present. And I'm like, well, duh, do this. But you're not, it's stuff for you, but not for them. And that's why you have to explore with them, because you can you can never know what's best for somebody else. Only they can know it. And that's why they have to come to the conclusion themselves and nobody else.
Yeah. And I would even take that a step further in saying that if I were to say do this, they will come back and be angry at me. I'll guarantee you, because inherently we all want to feel like we make our own decisions and nobody is dictating our life.
Right.
And so while we want someone to decide for us because we don't want the responsibility and we also can't handle the unknown, we also, though, want to feel like we're choosing.
Right.
We're in control.
Right.
And so if anything, I'm disabling them from that, and I automatically, I know they're going to be frustrated in the future. So I want to save that from happening.
Yeah. Yeah.
So why don't we talk a little bit about what some of those questions are? Like, do you have examples of questions where you felt that feeling of, so I don't have an answer to this? Right.
So most definitely the job, like that has definitely come up. Like, should I take this job? Should I leave my job? I think there's sometimes like halacha questions that come up.
That's a big one.
Right. Like Shabbos questions, like, am I allowed something for my mental health? Am I allowed to do? I think it's interesting though that I have educated people that you can ask a rabbi. Meaning sometimes it didn't necessarily come up as a question, but they're like, what should I do? I'm so nervous. I can't really fast this fast because, you know, I suffer from an eating disorder. And I'm like, right, you need to speak to a rabbi about this. Like educating the fact that even though I maybe can't answer this for you, there's somebody that you definitely need to ask.
Yeah. Halacha is a huge one. I think that comes up for me also a lot with, you know, what is better for me to do religiously? Like, should I go to shul for Parshas Zachar? And I don't always know the answer to that because I know what I would do for myself. I know what other clients or friends or family members have done, but I don't know what's good for you to do. And I don't know what's right for you to do. And that's a decision that them and their Rav have to come to.
Right. I think there's legal questions also that are sometimes brought up.
Yes.
Sometimes we have to educate people. Like, yes, you know, even though I might not be the one to tell you what to do in this case, but this is a legal question that you need to speak to somebody legally about.
Yes.
I think finances, though, is a big question where I feel like I'm not equipped to answer that. When somebody's, let's say, struggling in debt and they have questions like, does it make sense to spend this? Does it not? I'm like, I got to answer that for you.
Yeah. I mean, you know, everyone's spending habits are going to be different based on, you know, what their needs are. That's always, you know, a good thing of where I go to with people is, well, what is your need?
Right.
Like, what do you need? What is your baseline? Mine is different than what yours will be. So let's start there. It's not about the comparisons. It's always about where you are holding. And also then obviously it has to be within the realm of feasible. Because if it's not feasible and you say my need is to spend $1 million a month, unless you're making that amount, you probably can't be spending that. So it has to be reasonable. But, you know, in that case, you might say, well, I think you need a financial advisor. Right. I've said that to people. And, you know, I think you need someone to help you budget. Yeah. You really need to go to a financial advisor.
So I think there's like kind of this the space where as a therapist you can educate the client that there are other people out there that can help you with these certain topics or answer these questions for you, but I also can't answer them for you.
Right. You know, it comes up a lot. People will say, should I marry him? Right. Should I marry her? And sometimes it's even bigger questions of the person that I'm dating has a mental health condition. Do you think our marriage will be good if I get married to them? Right. That's a big one.
Right. Do you think I should send my kids to this school?
Yes. Yes. Right. Do you think I should live in this community?
Right. That's a big one.
Do you think I should be friends with this person?
Right. And these are all really good questions.
Yes. And they're huge questions. And I think, you know, we've all been through personally these questions and also, you know, as clients or friends go through these questions, they're not always the same answers. It's really specific case by case. But, you know, it comes up also, people will say, should I go on birth control? Right. That's not a question that I can answer, right? And so a lot of times I think the common theme is that all these questions are yes or no questions. And I don't think a therapist can really answer those directly. You're probably never going to get a yes or a no from a therapist when you ask those questions.
I'll probably get a, what do you think?
Right, exactly.
Which I'm sure all clients love.
Yeah, so I know that's a bit overused, but I think it's really because we can't say yes or no.
Right.
And I mean, maybe like what would be a better way for them to phrase the questions?
To get a yes, to get more than a yes or no?
Yeah, to really, they want to, because when they're bringing up these questions, right? You know, career change, should I marry this person? Should I spend more? Should I spend less? They're really trying to ask something.
Right.
And so we don't want to completely discount the whole conversation because there's material here that needs to be delved into.
Well, as a therapist, I kind of try to dig deeper, right? And I'm like, what's coming up for you here? Or what are your thoughts that is really driving this question, to kind of get more information?
Yeah. Like to help expand it.
Yeah, to help expand the question. Exactly.
Yeah. Yeah, I think that that's a good one. I sometimes also like want to know what brings up this question now.
Right.
Like why now?
Yes, why now? Exactly.
You know, you've been dating this person for 2 years. Why now?
Right.
You've been at this job for 5 months. What changed?
Right. Because that's a really gives a lot of information about what's going on.
Yeah. And that can really expand it. You know, one of the things also I think that comes up with this is asking what should be done, but also then asking, is this normal?
Right.
So is it normal that I'm eating this amount per day?
Right.
And I'll say, you know, that's an interesting question.
Right.
I'm not a nutritionist, but I think that's a really good question for a nutritionist for you to discuss your diet plan with them.
Right. I think that's a really good, like, kind of veering off to a different topic of, is this normal versus like, is this healthy? Mm-hmm. Like pretty much most things are normal, right? The feelings are always the way that you feel, but they're not necessarily healthy.
Mm-hmm. Right. And, you know, another thing to that is it normal? Is it healthy? But also, is it within your value system? Because there's certain things that it's not about whether it's right or wrong. It's not about whether it's normal or not. It's about, are you the kind of person that wants to be doing this?
Right.
When it comes to sending a kid to a school, it's not about right or wrong. Like there's variety of schools. It's about, do you want your child to grow up with the values that this school has said that they're creating this type of child, this type of adult?
Right. I think that's, you know, huge. And like, there's so much more there that we'd have to discuss at like a different time.
Yeah.
That would take us off totally topic, but I think that's a really huge point.
Yeah. Like what is normative?
Is it within your is it within your value system?
Yeah. And do you have a value system, right? You know, taking it a step earlier, what is your value system?
The one thing that I would tell somebody who is, you know, telling me like, oh, okay, I'm going to therapy tomorrow for the first time. What should I know? I guess it's that whatever happens, like that's good. Like you kind of don't set such high expectations for the session. However the session plays out, whatever you talk about, you don't need to like come prepared with topics. Whatever is good. Mm-hmm.
Like just be.
Just be. Just be, exactly. People come with many expectations for what a session looks like, and then could be like, wait, but I didn't talk about this, or how come this didn't happen? And just experience the experience.
Yes. I think that that's a really, really good one. Just take it as it comes. Like just be in the moment, see what happens, let it play out, and not feel so much pressure, because then you're not really taking it in if you're feeling all of those expectations or I got to cram it all into that time period.
Yeah. I think that would be the one thing that I would tell someone.
I think also, you know, one of the things that I would tell the person, in addition to what you were saying, because I think that that's a great one, that the therapy outcome is more based on you than anything else.
Right. You dictate the therapy.
You dictate the therapy. Exactly. Right. It's what you're making of it. It's what you're preparing for it. It's the material that you're bringing in. And also, if the therapist says something you don't feel like you feel hurt by, is to really see all sides of things. Because change hurts.
Right.
We all love being so comfortable, and, you know, myself included. No one wants to hear criticism or what they're bad at. And really for us to take a step back and to say, can I grow from this?
Right.
Can I gain something from it, rather than feeling like it doesn't feel comfortable?
So the top 2 things we would tell somebody before they start therapy is to just be, and also to know that change hurts.
Yes. You know, one of the terms I love is comfortably uncomfortable.
Mm-hmm. Yeah.
Like there should be the safety and the trust and the vulnerability, but also there's going to be a discomfort in talking personally about yourself.